Okay, so this pre-op form that we're going to discuss now is going to be the lift. So a minute ago, maybe, we talked about the augmentation part. This is going to be the lift with or without the implant. If you are getting the implant, then you are going to get information for that augmentation video that I did. And a whole separate consent form for the augmentation, because they're technically separate surgeries. So you're going to get different consent. You'll get one consent for an augmentation and one consent for the lift. So this lift is called a Mastopexy. This is your consent form. It is almost identical to the augmentation consent form. There are some differences though. So I just always like to read through those and just make sure that you understand everything. The thing with the lifts is that you can have different types of incisions. You could have periareolar, to think about that word. You can have a lollipop, which is around and down, and then you can have the full anchor lift, which is around the areola, down, and underneath. So when you come in for your initial consultation, usually if somebody needs that anchor lift or even the lollipop, a lot of times Dr. Kratschmer will have that conversation with them to just kind of let them know, like, you're going to have this incision. If you have questions about it, the pre-op is with somebody from the staff, so we may or may not know that information depending on if it's drawn out in your chart, if we've seen that. That may be a conversation that you have to have with him the morning of your surgery. So if you don't know, ask him the morning of your surgery to just make sure and clarify where your incision is going to be, if that's a concern of yours and if you don't already know. They are around the areola. Pretty much, if you're having a lift, it's at least around the areola, so that's what I will talk about. So the nice thing is, if you watch the augmentation video, I talked a lot about the chance of opening that incision and things like that. Well, when it's around the areola, it's not as much stress. It's not right here under your arm where these muscles are. So the chance of opening your incision when it's around the areola is pretty slim. What can happen though, I would say it's pretty common though, if you have a lollipop or the anchor incision where you have the circle come to the T part right here in this little, where these two incisions meet, that's a lot of pieces of skin that are coming together. So sometimes people can just have like a little opening here after, a week or so. And then their concern is because, let's see, it's like, let's just use this. So if it's around here and then down, so it'll be like right here, and then, which I always call, if you have questions about it, always call. But people will say like, oh, it looks white. Well, this is granular tissue. I think that's what it's called, granular tissue. And anyway, so it is white. The tissue itself is white. It's a little bit different, so people see it, and if you see that white, it's not necessarily pus, it's just the color of the tissue underneath there. For your recovery, you're gonna go home in gauze and a sports bra, or our surgical bra, our surgical bra, which closes in the front. You can get a sports bra if you'd like to switch them out. People really like our surgical bras. They think they're comfortable. Nothing special about them. They're just very soft and they clasp in the front. If you can find a sports bra that does the same thing, you'll probably be equally as happy. People want to know what size do I get? I don't know what size. I'm adding an implant. I don't know what size to get. If I'm losing size, I'm doing this. The bras and things are usually measured by the band size. So if you're small, buy small. If you're large, get a large. Because the tops are stretchy, so those don't really matter so much. And you'll want some compression. You don't want to bounce all over the place because it hurts. So the tissues are sore and swollen. It feels like engorgement. So It's like, sometimes it can just be rock hard, it's uncomfortable, and you just want something tight. After you get home, you will start doing clean, dry dressing changes every day. Leave the steri strips on, just take out all the gauze and things like that, replace it with new gauze. I would, for the augmentations and the lifts, I would just go to Target, Walmart, whatever, go to the baby aisle and get the nursing pads and get a box of like 100, because you are going to want to put a nursing pad on every single day so that you can like monitor the drainage that comes out every single day. Change that out so that you can see what's draining, where it's coming from, what color it is, and you can notify us if there's an issue. So buy a big box of those disposable nursing pads, and that's all you need. You don't need to tape it on. If you keep taping stuff onto your skin every day for a week, you're going to be miserable because you're going to be raw and miserable. So just take off all the gauze. When you shower, you can shower 24 hours later. Shower, let it hit you from the back, let everything, you know, just kind of dry. If you have your steri strips, if they're wet, take a hairdryer on low, not hot, because you won't feel it. You'll be numb, you'll burn yourself. Hairdryer on low, dry it off, put a pad on each and cover it back up. Done. And then just take it easy. So still, just because you have a less of a chance of opening your incision doesn't mean you can go crazy. You still have lifting restrictions, nothing heavier than a gallon of milk for 6 weeks. No working out until he calls you. You want to still have T-Rex arms, meaning everything needs to be like in this area for a couple weeks. Nothing, you know, none of this, you know, T-Rex arms. And you can drive, just again, watch grabbing and closing that car door, because, you know, it's one of those things you don't think about. It's always it's not really the slow, controlled motions that mess people up. It's the sudden things that they think, oh shoot, I wasn't supposed to grab that. Oh shoot, somebody's falling, let me catch them. Oh no, I wasn't supposed to do that. Oh, I'm falling. Falling on a curb. Let me catch myself. Those are the kinds of things that mess people up after surgery. It's usually not like, oh, I very slowly washed my hair. Okay, so you will want to get up walking, you know, as soon as possible. Lowers the chance of any type of blood clots. So, you know, get up, walk around the house. You're not restricted with that. You're just restricted on your heavy lifting. You're going to want to sleep on your back. I recommend sleeping slightly elevated to help with the swelling. If you're one like me that gets headaches, if I am swollen and lay on my back, I'm going to wake up with a migraine. You can, oh, I already said that. So watch the scars, watch the incisions to help prevent scarring. You're going to want to you know, just keep them protected. Don't put anything on them. No Neosporin, no ointments, no anything unless he tells you to. The people that go and they start putting Neosporin on their incisions, Neosporin can barely heal a bug bite. Barely. It's not made for surgical incisions. And if you use it for several days, you're going to kill so much bacteria that you're going to let the fungus grow, and you're going to have a raging fungal infection. It's going to be like a red, itchy rash, and you're going to be miserable. You don't need to do it. You don't put anything on it unless he tells you to. Then no heating pads. You can have a heating pad on your back if your back hurts, but nothing near the front at all. You can you need to check your incisions every day. Well, it's hard when they're covered with steri strips, but after the steri strips come off at 2 weeks, you're going to take a shower, you're going to take the steri strips off while you're wet. People freak out about taking it off. They're so easy. Just peel them right off as soon as you get out of the shower. Just peel them right off at the 2-week mark. If you have any little openings, it's fine. Just watch. Just watch it. If you have the, if you are opening right there on the bottom, just keep something dry on there. Take a picture of it. If it's concerning to you, then let us know. We can see the picture and see if there's any issues or anything that are going on. I feel like there was something else that I should have told you. Oh, actually, yes, there is. So when the incision around the areola, we make it in a circle, very accurate circle. When you're up and healing, and we use actually these sutures, they're called Gore-Tex sutures, and they are made, we use them, they're the best thing to use to help keep the skin from stretching. But sometimes, especially if you do an implant at the same time as your lift, and some surgeons won't do them at the same time because the areola can stretch like that. For us, it doesn't really happen all the time, and it's kind of rare that it kind of stretches. So it's such an easy fix. You can numb it up with a local. You come in after the 9-month mark, we numb it up with a local, and he just excises the skin. It's better than making you pay for a whole nother surgery later on when we can do a skin revision. So a lot of times that's what we do. It's not always needed, but sometimes they just don't heal in a perfect circle. They just, when you're up, you're walking around, this one's pulling this way, this one's pulling that way. It's kind of just your skin just kind of does whatever. Sometimes one side will heal in a perfect circle and one won't. I mean, that's not something that, it just, you're here for a lift because your skin is stretching and maybe sagging in some parts. So that tells us that the elasticity in your skin isn't that great, which is why you're needing a lift in the first place. So when we do an incision like that, your elasticity is not great. So sometimes it can just cause those, it should cause them to look different, or it can cause them to not be in a great circle. So if that happens, let it heal. Revert back to that post-treatment care plan video where I said you are going to come in a week, a month, 3 months, and then if you need a revision, it's going to be at the 9-month mark after your incision is considered a scar and no longer considered an incision. That is when we can do those little things. And as long as you've come to your follow-up appointments, we fix it. And it may be, so the sutures, the Gore-Tex sutures are kind of expensive. Those are a specialty suture we like to use. They're included in the cost of the first surgery. We already used it to try and prevent this from happening, but if we need to use them again, then you may have a suture cost. 100, 150 bucks, 200, something in that range of just you paying for the supplies for us to go in and numb it up and resuture it. And this is a local anesthetic, meaning you're awake, the area is numb, you're fine, it's not that bad. It's like having a mole removed. That same kind of anesthetic where they numb the skin. And you can drive yourself to and from the appointment. So easy. So you're good. So if you do not look exactly the same, or it's not the shape you want, don't freak out. Get through the initial healing period and we'll make that adjustment for you. We do a lot of lifts. We do a lot of skin lifts in our practice. It's something that, it's a patient population that we have. We have more lift patients, I would say, than we have younger patients coming in for, first time augmentation. We just, it's just our demographic. So we do it a lot. If you have sometimes bigger lifts or reductions, I should also say that everything in this video applies to reduction also. It's just when you have a breast reduction, I'm trying not to say that word because I don't want my videos to be blocked. When you have a reduction, then depending on the amount of tissue that's removed, sometimes we may put a drain in, a little Penrose drain. It just looks like a little open, it looks like a little plastic tube or like a straw. It's just, kind of maybe right here on the side, on each side. I don't know if you can see me. If you have a little Penrose drain, then you just take a piece of gauze and cover the end of it and just kind of tape it down and change that out. The Penrose drains don't drain out like a JP drain, like a bulb drain. They just don't have as much fluid. They have some, so you just keep changing out the gauze. And when you come in for your follow-ups, we kind of advise how, you know, when we'll take that out. People get very scared about having the drains taken out. They think that it's going to be painful, and I get it. I was one of those people, but your skin is numb. We cut through all of the nerves and stuff. It takes like a year for you to get all of the feeling back in your skin. So you actually don't feel, I can't say you don't feel it, because some people are very sensitive. All of that is numb. So all we're doing is we're cutting a tiny little stitch, and we're pulling it out of numb skin, and you don't even feel it. And a lot of times people will brace for it and not even realize that he already took it out. So if you are having anxiety about having your drain taken out, please don't. We don't use drains for just the regular lifts. We will use drains for reduction type surgeries where we are removing a substantial amount of tissue, because that's the time that we will have more drainage. We don't have enough in, you know, regular, normal, everyday lifts to warrant a drain. The other thing that I'll talk about are stitch abscesses. A stitch abscess is a little suture, because we use absorbable sutures, so they all break apart. But sometimes they will, many months, I've seen these things like months after surgery, where your body's still trying to get rid of these little pieces of suture. It pushes them out of the skin, but it gets caught like an ingrown hair. If you've ever had an ingrown hair before, you know that it gets caught into the skin. It makes like a bubble of like pus. It looks like a pimple. And so if you have that, what we will tell you is don't pop it and, you know, risk spreading, you know, the pus and bacteria everywhere. Just cover it with a little Band-Aid, and after like a day or two, it'll rupture on its own. It'll work its own self out. If it's been a few weeks and you have these little pieces of suture material and you can see it, sometimes we'll tell you to just, you know, get a pair of tweezers, like soak them down in alcohol, dry them, and then you can grab those little, you know, the little free pieces. And if you tug on them, if they're loose, like if they're already breaking apart, they'll come right out. Like you barely have to. If you kind of just a slightly little tug on them and they don't come right out, then just leave it, because they're not ready to come out. When they're ready to come out, they'll just come right out. So you can do that if you see that happening, to kind of prevent those stitch abscesses. But the stitch abscess is always that call that I get a couple months later where patients are worried that now they have something going on with their incision. And it happens. It's fairly normal. It's just a part of your body's process. So that's it. So that is the post-treatment lift instructions.